Okay, well, great. Well, thank you for having me. I'm excited to talk about this project. It's a new project, and we're really excited to get started. So our project does increase use of long-acting reversible contraception, or LARC, have unintended costs. And we have kind of a big program team, at least in terms of my experience. I'm the PI on it, but we have a bunch, and I'm an economist. Some have come from the social sciences, and we have a bunch of other social scientists involved in the project. So Mika Eckhart is kind of the main collaborator. She has a lot of experience examining and doing research on LARC use and the correlates of it. Katie Gifford and Mary Joan McDuffie are involved in the Medicaid research program at University of Delaware. Erin Knight is really involved with that too. She is co-director of the Center for Community Research and Service at UD, and she has a lot of background evaluating LARC use as well. Dominique Medaglio was at Christiana Care. Now she's an epidemiology PhD student at Penn. And we have two mentors, Kim Isett, who is a health scholar in charge of the public health program at UD, and Mia Papas, who is at Christiana Care. So I just want to give you a background about the kind of the research questions to help you understand how we motivated it, and I think some of our experience with getting funding. So our main research question, again, is thinking about how LARC use could have unintended consequences. So if you look at kind of the upper left trend, that is the trend in long-acting reversible contraception use by device. So in general, we think about LARC products as IUDs and implants. And these are really kind of, a lot of them are, well, there's been newer products released in the market. There's been a lot of emphasis on preventing unintended pregnancy, and LARC use is the best for preventing unintended pregnancy. So there's been a big increase over time, over the past 10, 15 years, in the number of women choosing LARC rather than other forms of contraception. Around the same time, there's been kind of an upward trend in STDs in the United States. Especially STDs that could be potentially related to lack of protection. So we're not going to look at HPV because that's kind of a different disease process. But if you think about chlamydia, gonorrhea, syphilis, right, these have all had large increases in the U.S. And so we want to investigate whether there's a relationship between these two. And so what we're going to look at is LARC adoption and STI diagnosis. So do we see more people being diagnosed with STIs compared if they have adopted a LARC rather than other forms of contraception? We're going to look at treatment costs. And we're also going to look at adherence to annual preventive exams. So the thought here is that if LARC prescriptions are good for anywhere from 3 to 10 years. Maybe women are not going to see their provider every year to renew their contraception prescription, and then you might miss some preventive care that you would otherwise have. And there's been large efforts in the medical community and in the public health community to say maybe we should look at these trends in STI increases. And if there's a relationship between LARC and STIs, there's been relatively few studies that have explored them. So that's our kind of main thrust of our research. Okay. So our project history, I think it's important to understand so you can understand kind of how we developed this application and kind of what we've been able to really leverage. So there's two large existing research efforts at UD related to this, right? And the first is the Medicaid research program. So at CCRS, which is a research center within the Biden School, we have the Medicaid claims data, I think since about 2008, I believe, and then good cost data beginning around 2012. And this is used for research purposes. You need to have a project agreement with the Delaware Medicaid program, and we have dedicated researchers that can protect the confidentiality of Medicaid claims, right? And so we're really trying to understand a lot of the social determinants of health with this, as well as different health outcomes. And so, this is a really important program. A lot of states are doing this as well, but we kind of have this big existing program with, people dedicated to that. And I would be remiss to not encourage others that may be interested in using this data. There's an INBRI research proposal call that is due in early November for use of this Medicaid data. So we're going to use this Medicaid data and kind of build upon the existing strengths that are here. There's also been kind of a large multi-year evaluation of the Delaware Contraceptive Access Now initiative, which is DELCAN. And so this, if you look at the figure on the right, there's one paper that's come out of that. So DELCAN is a big effort within Delaware, and especially for lower income women, to have more contraceptive access and to be able to choose the contraceptive choice that makes the most sense to them. So there's been a big emphasis on provider training. There's been, a lot of different initiatives within Delaware to try to help women kind of choose what they want to do with their contraceptive use. So as you can see here, right, in Delaware, we've had kind of a big increase in LARC use, which is going to help us empirically to really think about the effects, right? So we have this big upward trend in Delaware among LARC use. Okay. But importantly, with the DELCAN initiative, they're looking at a lot of different outcomes related to LARC adoption, but STIs are not part of the evaluation. So we're really filling in this, missed opportunity where there's not been a lot of research, despite having large upward trends in STIs in Delaware, as well as Delaware being kind of a high state for STIs. Okay. So, kind of with all this stuff in the background, I want to think about what has contributed to our success and how we were able to get an Excel grant. Okay. So, I think we often talk about when we're talking about our successes, we forget to talk about our failures. So I did have an unsuccessful application for the INBRI Core Center Access Award, which is the award I was just referring to that allows for Medicaid or evaluation of or use of Medicaid data in Delaware. And I think that's important because as social scientists, it allowed us to understand kind of some of the people evaluating these grant proposals that come more from the medical community, so to help us think about how we want to frame our arguments, how we want to discuss our studies to make it more sense and more appealing to people in other disciplines. And it really helped us improve, with those comments, it helped us improve our application overall. So we had the kind of same basic idea as that we applied for with the INBRI Award, but that kind of unsuccessful proposal made us kind of rethink some of our framing, rethink how we were going to present it, kind of think about also our different methodologies that we were going to use. Okay. We also did a lot of planning for this. So we took the basic write-up for the INBRI Access Award, which is I think about a page, maybe 2 pages, and we really kind of used it to start our research strategy, but we went through lots and lots of drafts. So every member of the research team reviewed it and made comments. Mika and I really worked on it really closely, and 15, 20 drafts at least of kind of how we want to describe our research. And then we also allowed, got comments from colleagues at the Biden School that have familiarity with NIH grants and kind of have that background, but they've, they don't have specific expertise in this area. So it also helped us say, okay, what would an outside reviewer think about, and what would they think are important? So we got a lot of feedback. We worked really hard on that research strategy. I also think we worked really hard on organizing all the documents. So if you go through an Excel process or any other, large NIH type grant, right, there's a lot of different areas that you need to work in and assemble the application. So we really worked hard on organizing the documents so that we were able to assemble, and we were able to, do multiple drafts of different sections without it being too onerous. So I think that helped us, really trying to think about, that we could access previous drafts easily on the cloud server. We could keep different parts separated so that we could all work on different parts of the application at different times. We also, I think, motivate the topic both narrowly and broadly. So by narrowly, I mean we really focus on the fact that Delaware is a unique setting for this because of the large increase in LARC use, as well as the problem of STIs in the state of Delaware. So we use Delaware as a really important case study if we want to think about taking this nationally, but we also framed it in kind of a national context. So LARC adoption has really been kind of a big emphasis in public health and in women's health, especially with the Affordable Care Act. So I think as we look forward to hopefully applying for an NIH grant, we can leverage that. So, we're saying this is not just a problem for Delaware, but it can inform national policy. So as we think about our analysis and as we think about, doing it, we want to keep in a thought about how we can motivate this externally, for external validity, how we can think about eventually incorporating more states to see if our relationships hold outside of just the Delaware context. And finally, we work to expand the research team to include partners outside of UD. So our initial INBRI core access proposal was just Mika and I working on it, but we worked to really expand the research team to fill out other components of it that were missing. So one thing the INBRI comments suggested is we should get a medical professional or a doctor on our research team, and we did that. So we have Elizabeth Brown, who is Director of Medicaid Services in Delaware. She's a physician and has great expertise in Medicaid and Medicaid research. So she's helped advise us, and she gave us some comments on the research strategy to really improve it and to think about how we can use our findings in a clinical setting. We also work to include partners in Christiana Care, so we have multiple Excel partners within our proposal. So we've really kind of tried to expand the team, expand the expertise that we're bringing to that. And I think that was really useful, not only for getting the award, but also just improving the research strategy to get lots of different perspectives, the perspective of different disciplines, and the perspective of different people in the healthcare sector. So that's some of our members of our research team. Not everyone has a photo up, but I'm happy to take questions about that, either here or if you want to email me, because I'm really excited to work on this. We've started to extract some of the data, the Medicaid data, and so we're really getting excited to start doing the analysis.